Thank you so much for joining us, Dr. Fradin-Read. For those of you who are watching, Dr. Fradin-Read is an excellent physician based out of Santa Monica in California, who I've had the pleasure of working with for a couple years now, closely on a couple different projects. And we absolutely love talking to her today. Really, we want to talk to her about one of her specialties, which is sort of patient education and how to have discussions with patients about this topic, which is going to be a little bit new for them. Thanks so much for joining us, Dr. Fradin-Read.
Thank you for inviting me. I'm so happy to be with you today.
Thank you so much. I obviously talked a little bit about your background, but would love to hear an introduction from you as well about some of your subspecialties with patient education.
Well, when I moved to the United States after being a physician for 12 years in Europe, I had to restart a residency, and I did my residency at UCSF in internal medicine and moved to Loma Linda in preventive medicine. At the same time, I was able to follow a master's in public health, and my major was in patient education and health promotion. So this is one of my favorite topics, educate the patients and help them get better with their health. So I think I can maybe help some of our colleagues take a few of my tricks to educate their patients.
And I think that some of the background in preventative medicine as well as a focus is really impactful for this too, just given the predictive value of these tests for all chronic disease. And so I'm excited to hear some of your viewpoints about that as well. And so in order just to kick it off, I'd love to hear a little bit more about sort of how you have this discussion with patients whenever you talk to them about this type of testing.
So in general, I try to make it very simple for my patients, Ryan. I first tell them, we need to understand why we do a test, the rationale for doing that test. So I define the new concept of aging, which is per se by itself a factor of risk for a lot of disease, chronic illnesses as we get older, cardiovascular disease, diabetes, Alzheimer. And I tell them, that new factor, that aging factor, can be identified with some tests, some biomarkers, new biomarkers that can really predict your future quality of life. And maybe we can impact the future by doing some interventions. So let's start by finding a starting point that would be accurate, what we call the real age.
And I think that one point that I always like to underscore as well, just to echo your points, is how highly linked these things are to those different diseases. I think that the statistic I always like to mention, and I believe it's one you mentioned before as well, is that if you reduce this epigenetic age by 7 years, you can reduce morbidity in the population by 50%, and that's a pretty astonishing statistic to think about 50% of the disease being gone. If we could have every patient view this as one of the biomarkers to go by.
Yeah, and I can tell you, I tell that to my patients most of the time, and they're excited. I want to do that test right now. That's what they tell me. So then after telling them the why, I tell them, what is it? What is that test? Okay. So I first go into the explanation of what is an epigenetic test as opposed as a genetic test. They know the 23andMe, everybody has more or less done or heard about it, and they know that's going to tell them a picture of their genes when they were born. So I explained now, you might be 50, you might be 60. Who knows where your genes are? You might have good genes at birth, but because of lifestyle or exposure to toxins or different factors, your gene might not be as good as they should be. And everyone that was born the same year might not be exactly at the same point in life in terms of real age. So I really focus on the definition of epigenetics, and I reflect to that Time magazine issue a few years ago that was fantastic, telling your genes are not your destiny. You are going to be able to change your future life and improve your quality of life and reduce your risk of burden of disease by doing a few things. So let's see where we are now, and that's the true age test.
I love that as well, and especially even some of my personal story. I have a ApoE4 variant which would predispose me to Alzheimer's, and I always find a little bit of comfort and find that a lot of people might also find comfort in knowing that 60% of these epigenetic changes or I should say epigenetic values are changeable and in your own control. And so I love that saying that, your DNA is not your destiny.
I tell them, so how do we do the test? It's very easy. It's going to be either a blood test in my office, but you can also do that at your home. It's a little prick test on your finger, and you will send the sample to the lab. It takes 6 to 7 weeks to come back as a result. And we're going to identify along your DNA what points could be damaged over time. That's what I call the picture of your genes. So I sometimes go into the methylation process. Not all patients want to know that, but the fact that one of the best predictors for aging now is to identify those points on the genes that have been, impacted by the methylation process. So not all patients want to know about the methylation process, Ryan. So I sometimes go in the detail of explaining the damage along the DNA. But in general, they are not really interested in knowing that. So most doctors will figure out that it's not really necessary to go in all the details of the explanation of the test.
So at that point, after you sort of explain all of those different considerations, what are some of the biggest questions that you generally get from your patients?
I tend to first tell them, that's the best test on the market. They might have heard about other tests that are coming more and more. And I tell them with TruAge from TruDiagnostic, you have 850,000 points that have been identified. It's a company that's very well oriented towards research. We have several IRBs that we are developing with several institutions. Being from Loma Linda myself, I'm trying to develop some research knowing that it's a blue zone and we have a lot of centenarians over there. So it will be interesting to see how they score on their AP-age ratio. The AP-age ratio is actually a number that will be given that tells you the speed of aging. And what I explain to my patients is that then they can start competing with themselves next year. That's a very important point because they tell me, yeah, we do the test, but what do we do with it? So I tell them, well, we have a lot of studies and interventions, lifestyle, supplements, medications now that have proven to slow down the process of aging. And one of them is the study from Dr. Fahy at UCLA that has done very good results with the use of metformin, DHEA, and growth hormone in some patients. Some patients might not want to go to the full regimen, but we can definitely also refer to some nutritional interventions like vitamin D optimizations that has also helped in several conditions. So I show them that there is a goal to achieve, which is compete with yourself and slow down the process of aging. Then another question that comes very often is, what if I score badly? So I said, well, great, you can do better next year. And I had a patient, she actually did the test and calls me the next day and say, Dr. Read, stop. I don't want to know my age. I'm too scared to be older than I am. So I encouraged her to do the test, and she was finally 2 years younger in the biological age, the true age. There's another important point for doctors that I want to mention. It's a fantastic tool to discover hidden secrets. What I mean by that, a patient of mine does everything possible, to be good, to eat well, exercise, does my NMN, does everything I tell her to do, and she scored 3 years older. So she was very surprised and upset, and I said, well, let's talk a little bit. What could you have not told me since I've known you? I've known her for 10 years. And I discovered that she was smoking. So thanks to that test, we are now on a smoking cessation program. And I think that's going to be a fantastic tool to discover, as I said, the hidden secret that patients might not have wanted to tell you before.
I like the way that you phrase it to your patients, giving them a sort of a snapshot of their own health, but not making it a scary process, right? Making sure that they know it's changeable and that this is just a good metric to let them know how that they're affecting their aging. I think that it makes it much less nerve-wracking to get a bad score. Talk about the high correlations, and so I like the way that you present that.
It's very funny little stories. I have a group of patients. One of them did the test, And now all the friends want to do the test because people are really excited. When you tell them you can slow down the process of aging, I think it's really something that everybody wants to do, stay young and stay full of life. So one of them was not happy because he was a little bit younger with his chronological age than one of the friends, but we discovered that he does binge drink. And that was probably what impacted his numbers. So he's now willing to work and maybe reduce his drinking habit. So I think it's a really good tool for physicians to also help change habits, which we know is so hard, in terms of lifestyle.
One other thing that I often get, and I'm wondering if you get it as well, is I have a lot of patients who ask, how does this differ for telomere testing? Do you happen to get that as well?
Absolutely, yeah. Everybody, almost everybody has heard about the telomere test. So I tell them, okay, we had the telomere test, which was a good test. And I mentioned that TruDiagnostic is going to come very soon with another test, which is the telomere test. But I tell them, the telomere test tests the caps at the end of the chromosome only. And now we're able to test the corpus, the inside of the chromosome, which might have damaged places, these loci, what we call loci on the genome. And it has been proven in studies to be more accurate as a predictive values for the real age, actually. But I tell them what would be good is to have both. And once we have the new test from TruDiagnostic, then we will be completely set up to evaluate your age.
And we're excited about that one. And, I think that by looking at the leukocyte DNA, we can really predict that telomere length and have it, helpful for outcomes as well. And so now, hopefully, with one single DNA test, you can get a little bit of both in terms of value. Another test that we're coming out with is one that I know you and I have talked a little bit about offline to some degree, which is going to be almost like a death prediction clock. And one of the benefits, as we mentioned earlier, about the way you approach this with patients is by talking about the sort of making it low risk so that they can see that this is a good snapshot of their health, but not be too worried about it, just sort of helping make sure they compete with themselves and sort of trend in the right direction. Knowing that things like GrimAge by Dr. Horvath and some of these other death predictors out there, how do you think your patients might approach that as a metric? Do you think patients might be excited? Do you think it sort of raises the stakes? How do you think that will affect the patients you're talking to?
Well, I think, Ryan, that it's a deeper philosophical and even ethical question that we might want to talk for hours about, okay? I'm going to cite a French proverb, which is l'espoir fait vivre. I know I'm French, as everybody can hear. So l'espoir fait vivre means hope keeps you alive, but in a good sense. So if you lose hope, of course, you might not fight for your health the way you would. So we know that in terminal illnesses, patients who believe that they're going to be able to be cured live longer. We know the importance of the mind over the body. So it's really a personal question. Some people want to know when they're going to die, and maybe the elderly at the end of their life to prepare, organize their life, when they know they're going to pass very soon. But personally, I would prefer not, to tell the truth. And I don't think that my patients, most of them might want to know. It's something to discuss. There are pros and cons for sure. And I understand the interest and the logical of doing the test. Now, the willingness is different, for each of us. And I think we need to respect each patient's will.
We've talked a lot before. Some insurance companies are using this as ways to charge premiums and predict how much money they can make, and we want to stay far away from that as possible. Hopefully, though, we'll be able to sort of tie these to predictive death outcomes so that we can say, hey, if you're at risk of prostate cancer, we can see this in your epigenetics and make the appropriate changes. And so hopefully that's the long-term goal in making sure that you're empowering patients to make these right decisions. But I can completely agree and love that proverb. I think hope definitely helps you sort of take action on your health. And so this is great. And I think that you've laid a great groundwork for sort of how to have these discussion with patients. I know another interest of yours as well has been NAD for anti-aging purposes, NAD or NMN in terms of these precursors. And I know we actually have this IRB plan to work on this for outcomes. How do you think that this might help, and how are you seeing it help in your patients?
Well, I am very excited. I have used NAD for my patients and for myself for 7 years. And I can really tell that, of course, these are small, I would say, observational studies that I do myself, but the benefit seems obvious to me. We know that on animal models, we also have now proven that it can repair the DNA damage, it can help with metabolism, it can help with learning, brain support, it increases the BDNF in the brain, it has so many good impact on health. So I do believe that this is going to be one of the major components of anti-aging programs. I offer it to a lot of my patients. NAD, I think for some of the doctors, we should remind it's the nicotinamide adenine dinucleotide, which is actually not absorbed by orally, by mouth, okay? So we have come now with that NMN, the nicotinamide mononucleotide, which can be absorbed orally and is transformed as a precursor of NAD very easily in the cells. So we are now able to offer a very quality NMN thanks to Telomere compounding pharmacy, which helps with that component. And I have to admit, I had a patient who is 73 years old, who was really, really tired recently. And I told her, Nicole, her name is Nicole, let's try you on NMN. I cannot tell you, she called me a week later, she says, unbelievable. And this is a real story, I have her email, she says, I can finish my day, she's still working at her age, without being tired. So I could tell you on and on studies like that. I can tell you my studies, I can tell people who have improved their immune system because it also supports immune system. We know that the benefit of NMN, even in COVID, a real story, Ryan, a patient of mine, I had given him NMN for his energy and brain support, text me, I have his text, my colleague was hospitalized at UCLA for COVID and he was sent home with NMN. Unbelievable.
It's good to know that it's getting some I should say, worldwide appeal and appeal to a lot of different individuals. And yeah, I think that a lot of the things like NMN or NAD IVs or patches have definitely helped a lot of patients, and hopefully will continue to sort of show exactly how much these things can help in the aging process as well by having some objective data from this methylation values. And so definitely excited to work on that project with you, and hopefully we'll have another one of these webinars where we can go over some of the results once we get there. And in the meantime, just at a higher level, what are some of the other interventions that you're using in your office that you tend to really like, just to help people with overall health and aging?
So again, coming from Loma Linda and a fantastic university where we have now a lifestyle residency program for our physicians and our residents, beside the preventive medicine program that I followed myself, I teach there on a regular basis. We know the benefit of nutrition, sleep, stress management, all the different pillars of life, that we need to improve. So that's really like a foundation of my practice. Go deep with the patients and see how we can improve your lifestyle. So sometimes it's easy, sometimes it's not easy. Lifestyle change, we have a lot of resistance sometimes, but this is the first step. Once this is done, and we can do concomitantly, we can give some nutrition recommendations in terms of supplements and vitamins. I see so many patients that have low levels of vitamin D, for example, or low level of vitamin B12. So many patients want to go on a diet that is low in animal product now. So osteoporosis is a risk, and we know the risk also of low B12, low iron. So focusing on optimization of their nutrients, that's the second level of, I would say, intervention we can do in my practice. Then we have the third level, which is going to look at hormones and what we can do maybe in some cases around menopause or low testosterone in men that has proven to also help slow down the process of aging. It has to be done in a safe way, of course, and with all the guidelines of these, like the Menopause Society gives guidelines that needs to be, of course, followed seriously. Then we have the new generations of these fantastic supplements that we are working on, you and me, such as resveratrol, the fisetin that is coming, if it's not a secret. So how can we help eliminate all these free radicals, these toxins that we generate in our body on a daily basis? And that's something that I'm very excited about. And then recently, a week and a half ago, I got some very interesting education about peptides, which have become one of my favorite topics, fascinating results with patients. I could tell story nonstop about the benefit of peptides on myself, on some of my patients, patients for weight loss, patients for energy, peptides for different kind of, I would say, indications. So the world of the peptide, I think, is growing more and more in our practice too.
I'm glad you mentioned, you know, a lot about the diet and nutrition as well. I think even we were just recently notified that there's about to be a second intervention trial published in addition to Dr. Fahey and Dr. Horvath's TRIM trial, which looked at metformin from DHEA, and showing that even nutrition can have a result in reducing epigenetic aging in just 8 weeks. And so we're seeing some quicker changes that can hopefully help patients in a faster way, especially focused on nutritional status. And so, yeah, thank you so much again, Dr. Fradin-Read. I appreciate having you on, and I know that this will be one of many as we continue to learn more about this field and publish some of these different research trials and sort of break down how these all can affect a clinic and a practice. We'll definitely be coming back to you with more information. And so thank you so much. If anyone has any questions for you, how would you recommend that they reach out to you at Vitalife MD?
Yeah, you could definitely give my personal email. It's drfradin.read@vitalifemd.com. A little bit long, but I think you might help our auditors to know how to write it. Or just give us a call at Vitalife. Also, I'll be happy to answer any questions. And I love working with my colleagues, physicians, and whatever I can do to help, I'm here for them, for you. I'm very happy to develop more and more education and promote health around the world.
Thank you so much again, Dr. Fradin-Read. It's been a pleasure, and hopefully we'll talk again soon. Thank you so much.
Anytime. Bye-bye.
We've got a great video editing department who's helped me out more times than I can say.